Well, good morning again. Back to the Don Bullet Live morning show. And something y'all, my audience and Sandra, when she's here, it's hard to keep a regular job, Sandra told me. But anyway, Thomas McDowell, pharmacist at Rocky Mount Medical
Park Pharmacy.
It don't make any, I know where it is, and you do by now. But we're on again, and he has never failed to bring interest and education that could assist many, if not all. And today, I shared with your topic, but you need to restate it and start your conversation, because this is new, I would think.
Yeah, this is a new service that we're offering at Medical Park Pharmacy. So we're going to be talking about remote physiological monitoring, or RPM for short. And it's a new program at our pharmacy that we're offering, where we provide patients with Medicare. You have to have Medicare or Medicaid. We provide you with a free blood pressure monitor if you have a high blood pressure, hypertension diagnosis, or a blood glucose monitor to test your blood sugar if you are a diabetic patient. And it's a free monitor that we're able to provide our patients in the RPM program. We sit down with you and go over your medications and your medical history and discuss a plan for taking your monitor home and checking your blood pressure or your blood sugar. I've got to actually have a blood pressure monitor. We'll give it a shot and check my blood pressure and see how I'm doing.
Well, you're doing fine.
Well, I hope so. We'll see. And I don't check it super regularly, but if you have a diagnosis of high blood pressure, it is a good idea to check it regularly.
Yeah.
Because a lot of times you can't tell or feel the symptoms of high blood pressure unless it gets really high. And sustained elevated blood pressure is going to put you at higher risk for stroke and heart attack and kidney disease. And so it can be a silent killer.
Oh, absolutely.
And millions of Americans have high blood pressure. It's one of the most common disease states.
Well, it seems like if you find somebody that doesn't, they're out of the norm.
Yeah, it's rare. When we see somebody, especially
at least.
Yeah.
Irregular.
Yeah, we see folks over 65, and it's very rare that they are not taking a blood pressure medication.
Yeah.
As we age, a lot of times our blood pressure is elevated. And so we're able to provide you in this program a free, we'll kind of focus on blood pressure for this segment, a free blood pressure monitor. And the really cool thing about it is we'll help you with your goals and go over your medical history, and then we'll send you home with the monitor. And when you check daily at home, we will get the readings at the pharmacy remotely within just a couple of seconds.
Do you try to do it, you set a time, 12 noon or 4 p.m. or 8 p.m. or 8 a.m. or something?
We kind of work with the patient on their schedule and get a time to test.
Because being consistent, I guess. But checking different times also, because some people...
Yeah, it might depend on, whether they've already taken their morning blood pressure medicine or not, right. Or if they're going through some stress, they might check at a different time. So it's not, a really strict program or anything. It's really about your schedule. It's individualized, personalized. But we see the readings at the pharmacy as they come in. So if there's an elevated reading, we can reach out to you and check on you and see,
wonderful.
What's going on. And then if it continues to be high, we can loop in your primary care provider and talk to them and let them know, because primary care providers are super busy. Usually patients are seeing them no more than quarterly, sometimes only 1 to 2 times a year. And so we really at the pharmacy have a frequent high touch point, and we're calling patients all day long. They can walk in.
Well, I tell you, that can make a world of difference.
And so we can really be that that other link to the provider team and get these readings and let the doctor know about any issues that you're having. And we also send a monthly report to your doctor with all of your readings for the month. So they'll have that at your next appointment.
Well, we know what stress can do to a body.
Absolutely.
Or to mental health.
Yeah.
Or physical health. And having that contact because you can systematically just sit there and die.
Yeah, without really feeling really.
Well, I'm really
Yeah.
feeling bad.
Yeah, just if you're sitting at 160, 170, we'll talk about some of the numbers, but if you're sitting elevated, especially uncontrolled, untreated, undiagnosed, you're really putting yourself at higher risk for stroke and heart attack and kidney disease, which are very common in our area as well.
Well, I remember, as an example, and this has been a long time ago, a client of mine, he had not long before had taken examination and got life insurance and everything preferred, which you want. Well, I'd say within the next year, he needed some more. But at that time, he had to take it because of the amount. And it came back like declined. And it was because his blood pressure was like 202 over 120.
Yeah, really.
And he said, that can't be. I said, well, you need to see the doctor. Well, he didn't see the doctor. In less than 30 days, he had a massive stroke and limped, and he survived, but his life after that was so, inhibited because he couldn't walk. His hands.
Yeah.
And he had fair warning.
Yeah.
But anyway,
Yeah,
that was an example
that
that because he was an active in his business, he was active in athletics.
Yeah, it happens really often, and so another neat thing is that Medicare and Medicaid cover this program, typically at no cost. So, and patients that are in our RPM program and that are monitoring their blood pressure regularly, they're typically going to have better blood pressure control and better outcomes.
Knowing is the best.
Knowing, and then we can take action from knowing. So we're going to throw this on, and I'm going to attempt to check my blood pressure. And
You can check mine.
You want to check yours?
Yeah.
All right. You okay with sharing the numbers?
I don't get, well, I'll tell you, mine's irregular. One day it'll be
Palm up for me. There you go.
It'll be 160 over 90, and the next day it'll be 143 over 70.
So the key on this, we're really trying to get the tube fairly centered up in your, with your vein right there in the middle of the arm. And so this is one of our machines. It's a electronic, battery-powered blood pressure monitor. So you'll feel it start to tighten up, and when you're checking your blood pressure, you want to be nice and relaxed.
See now.
So, a little high?
Yeah. Maybe
I don't have you stressed out this morning, do I?
No. I've been coughing a lot, and I had a cold for the last.
Do you have any caffeine this morning?
3 cups.
So
that could do it.
Yeah.
But as I say, that's unusually high but I don't know if that's been coughing. I've been taking my little lozenges.
So, what we usually tell folks when we're checking, we kind of did that on the fly, but we like to sit down.
Well, that's good to
for
see.
About 5 minutes before we check. Ideally, avoid some caffeine because that's going to raise it a little bit.
Yeah.
But for our numbers, we're at goal. When you check your blood pressure, we're looking for less than 130 over 80. Typically, normal is 120 over 80.
Well, I think the last time, maybe 3 weeks ago, it was a 126 over 70 something.
Yeah, and that's about perfect.
But again, it will be.
It'll fluctuate.
It's not that, but it's.
Yeah.
I'm not gonna make it, guys.
I know. Well, and don't let one reading scare you. You know, this is the beauty of this program is we're able to get the daily readings, and so we're looking for trends. One elevated reading, our bodies are naturally going to have an elevated blood pressure if we're stressed or have, adrenaline pumping, fight or flight symptoms going on, or if you're really active or exercising, it's going to be elevated. We're looking for a nice trend of baseline, relaxed, calm state blood pressure readings. So that's why having a pharmacist check on it and be able to see those readings and monitor those trends, communicate to your provider is really key.
Well, that's exactly right. And knowledge is good, but I take a little, not a lot, but a little blood pressure, but normally it's never regular.
Mm-hmm.
It's somewhat irregular, but we'll see.
Yeah.
But I had coffee. I've been sick for a week.
You've been moving
but
around.
but other than that, I'm out of here.
Hey, well, so if you're interested in getting a free blood pressure or a blood glucose monitor, and
this is a real benefit to you guys.
And so we've have numerous patients already enrolled. They love it. It really empowers you as a patient
Gives you control.
that you can help be a part of your wellness journey, because you're playing an active role, not just getting some labs when you go to the doctor. You're able to get some blood pressure or blood glucose readings regularly, and you have somebody that you can talk to about it at the pharmacy.
Yeah.
And we spend a lot of time talking to our patients, providing care management services, discussing their goals, and really being an advocate for them. And so if you want a free blood pressure monitor or a free blood glucose monitor and you have Medicare and or Medicaid, come on down to Medical Park Pharmacy and stop in and ask us about this program. It's typically free.
And this is how recent?
We started this in March.
In March. So
Been working on it for probably 6 months before that, kind of getting ready to launch.
Is this just sort of going public type thing? Has it been around for a while?
It's in general, it's a new service that is a Medicare Medicaid billable service.
Pharmacy.
And,
Protection.
Yeah.
If you know beforehand, you can. It's like insurance. I mean.
Yeah, you can do something about it, and so it's pretty unique and new in our area. Not many folks are doing it. Not many patients are actively checking these readings. So our patients have loved it, and so you don't have to be a pharmacy patient, a customer of ours to do it. Mm-hmm. Anybody that has Medicare or Medicaid typically can just walk on in.
So somebody that does business with the large box store can still use this through you.
Yep. As long as they need a diagnosis of hypertension, high blood pressure, or a diagnosis of diabetes if they're looking for a blood glucose monitor.
Those are two. Blood pressure is probably the higher.
Yeah, and so they can go to a big box store for their prescriptions, and then they can come over here to Medical Park Pharmacy for the remote physiologic monitoring, the RPM program, where they'll get the free monitor, and we'll communicate with them, and they can still get their prescription somewhere else. So it's really open to the public.
You can't beat that. I mean, I'm not the sharpest tack in the pail, but that seems pretty good.
Yeah, and so it's one area that we really see a lot of patients kind of hit a brick wall on, especially if they're on a fixed income. Their doctor will want them to check their blood pressure regularly. They'll come to the pharmacy or ask about it. Medicare, Medicaid don't just pay typically for a blood pressure monitor on its own. So if somebody's coming and just trying to get a monitor and not participate in RPM, you typically are paying cash for it. So this is a way to get a free monitor and participate in this program for free.
Well, Thomas, we need to take a break. I don't know what your schedule is, but maybe if you could stay a few minutes, I invite the audience, if anyone out there may have a call, since this certainly has a different side.
Yeah.
And I'm asking you if any of the viewers out have a question. Thomas is kind enough to wait that advertisements are over, and then you can call in. So if you would, I'm giving you that opportunity. You don't have to. If not, he can go home, go to work. But I think because of what you said is something worth at least offering that. So with that, we're going to take a break, and we'll be right back and have your calls ready, if you will.
Thanks, Roger.
Well, we're back. You just heard Thomas McDowell talking about the blood pressure machine and options. If there's anyone out there that has any particular questions, or if there's anything that Thomas would like to add to that, he's given his time generously to us this morning. But I know there's someone or someone's out there that this could benefit.
Yeah, I mean, if you're looking at the numbers of folks with high blood pressure or type 2 diabetes, it's a pretty large percentage. And so if you have questions about checking your blood pressure, what a good blood pressure goal is, what the readings mean on the blood sugar or the blood pressure monitor, we're happy to answer questions here, and also happy to answer questions at the pharmacy. We're over at 901 North Winstead Avenue in the Medical Park building, often referred to as the Boyce Willis Clinic, big 5-story building right on the corner of English and Winstead, first floor, first door on your right, 9 to 5:30 Monday through Friday. And you can walk in, and we can typically get you set up with a free blood pressure monitor that same day. And if not, we can schedule you a time to come in and spend a little time getting it set up and reviewing everything with you, and you'll have a pharmacist really taking an active role in your health. And it's nice to have somebody you can call and ask questions.
Absolutely.
It's hard to get into your primary care. It's hard to. They're just so busy. It's hard to get somebody really quickly. You're usually leaving a message.
Well, I'm just thinking. I was with a friend of mine the other day, and he said, I need to go by the CVS to pick up something. So we had been to a meeting, and so went in, and we went into the CVS over on Sunset, and he came out and he was not happy. I said, what happened? He said, last time I'll be coming here. I said, what's up? He said, they've got all self-checkouts now. All self-checkouts. And he said, I'd just be damned if I'm going to do that. Somebody I can see eyeball to eyeball.
Yeah.
And I would think that it ties to you with personalization.
Yeah, we're really big on having that relationship with you, and it's more than just a transaction. When it comes to pharmacy especially, you really want to have a relationship with your pharmacist, because when you're dealing with critical medications, life-saving medications, potentially dangerous medications if not taken appropriately, you really want to be careful, and you want to see somebody and talk to them and ask questions. And that's just going to be the difference between a local family-owned hometown pharmacy like Medical Park Pharmacy and nothing against the big box stores, but it's just not as personalized.
Well, when the salaries went to 15 and 20 in California, robots and machines is what takes this place.
What folks go to.
And it's just like in my industry, they hear this on TV and they call the 1-800 number, and then they have a claim for disability or death or something, and they call and they can't talk to anybody, and the people they talk to don't know them or their family. And maybe there's something to be said about working with your local financial service person, your local pharmacist, your local people, because they do know you. And I'm as I started earlier this morning, buy locally, and all. But also remember those non-callers out there that are looking at the TV and saying, I should. Now the number, 407-1111. Maybe I need to give the number.
Yeah, maybe that's the number to call.
Yeah, the number is 407-1111. Feel free to call. And
There we go.
there we go. Pernell, you great. But also now we talked about this is also related to diabetes, and it seems like everybody I talk to has diabetes or near.
Yeah, and that's,
and tell the same
for
time.
sure. Yeah, and we can probably unpack that in more detail on another show because it's just so much to consider. And so, we've talked about type 2 diabetes on a previous show where the numbers are creeping up to about 20% of the population.
That's amazing.
Type 2 diabetes, or some of them undiagnosed. And so it's becoming it's a big problem, and it's primarily dietary and lifestyle based. But it also comes from the lack of knowing the track that you're on and what to do, and we're not taught, avoid processed sugar and carbs. Folks are just eating what they want, and when they're young, they think, well, I'm young and healthy, I'll be fine. Well, it catches up to you, especially if you're inactive and sedentary.
Yeah.
And we live in a world where folks are glued to their phones. They're not outside as much, they're not active as much, and we, a lot of people live a busy lifestyle, and working 40 plus hours is hard to find that time. But type 2 diabetes is going to increase your risk of stroke, heart attack, kidney disease, and shorten your lifespan typically. And so, especially if uncontrolled. And so, knowing your numbers is one of the first steps to managing and controlling it effectively.
Well, don't blame me, blame you by not calling, but Thomas is here every other week, and you can jot it down. But this is like once upon a time, if you're driving down the highway and somebody flicks the lights back and forth, right ahead is a opportunity to get a traffic ticket. Well, what this is like waving a flag because you're knowing that just ahead is diabetes or high blood pressure. So if you've ever had that happen to you, you know how gratifying it is when you see the highway patrol car and you knew and you cut back 10 miles an hour. So I'm just offering this as a Sandy Cross diagnosis. But Thomas, we really do appreciate you spending a little extra time because
Sure.
There's somebody, or there's a bunch of people out there that ought to call.
Yeah.
If not, you need to go visit him at the Boyce Willis Clinic, Rocky Mount Medical Park, and visit, go in, and you can set an appointment or call. What's your number again?
Yeah, so if you want to call and ask questions or get an appointment scheduled, like I said, it's all free for 95% of patients. If you have Medicare and you have original Medicare plus a supplement or a Medicare Advantage plan, the only one that we're not able to do at this point is Humana.
Yeah.
But any other Medicare Advantage plan we're able to do, and able to enroll you in this program. So our number is 252-443-7979. So
give it more. Yeah.
443-7979. So 443-RX if you want an easier way to remember that. And that was something the previous owner set up. So call us and get it set up. You're going to get a free meter if you're diabetic and you're already testing. You're thinking, well, I have a meter. I'm paying for strips and Lancets and paying for the meter. You can swap that out for ours, and everything's free. So you don't have to pay for your supplies anymore. All the supplies are free. So
my fellow Americans, that makes sense.
Yeah,
that makes sense.
It's a no-brainer.
And with that, we are going to thank Thomas again, and I'm going to say thank you for being with us. And we hope Sandra enjoys her morning with the ladies. And until next week, we wish you the very best. So have a great weekend.